And thank you so much, Shravni, for joining us to be an amazing speaker for this very important topic. For those of you who don't know me yet, my name is Nisha Udeen. I'm the founder and CEO of South Asian Care, so I'm partnering with Shravni to host this amazing session today. So really looking forward to it. But today we'll be talking about healing through generations, recognizing and healing intergenerational trauma. So I know this is very, very important. We have a lot to talk about. So I'll dive into give a little introduction about Shravni. Excuse me. Shravani is a licensed clinical mental health counselor originally from India and now practicing in the United States. Her work is grounded in trauma-informed care and shaped by a deep commitment to serving diverse and historically marginalized communities. Shravani brings together strong clinical expertise with the foundation in social justice advocacy and culturally attuned therapy. She is passionate about supporting both personal and generational healing, helping clients navigate the complex intersections of trauma, identity, and resilience. So I'm very, very excited to hear from her on this very important topic today. So Shavni will go through some slides, but at the end we do have some time reserved for a Q&A. So if you have any questions throughout the session, please feel free to just put it in the chat box and we will be answering them at the end. But with further ado, I'll pass it over to you, Shavni.
Thank you so much. I hope my audio is clear, but hello and welcome. I'm so glad you guys are here. My name is Shravni Aterkar. I'm a licensed clinical mental health counselor, currently practicing in North Carolina. I'm a certified rehabilitation counselor in all 50 states and a trauma-informed EMDR therapist. My clinical work focuses on supporting individuals with complex trauma, where I integrate trauma-informed and evidence-based approaches to foster healing. I moved to the United States from India in 2019 and have been in the counseling field for about 5-ish years now, working with culturally diverse populations. I have witnessed firsthand through my family wounds, as well as what my patients bring into our sessions, how intergenerational wounds shape families, impact interpersonal relationships, and disrupt daily functioning. This dual perspective, both personal and professional, deeply informs my work and passion for breaking cycles of inherited trauma. In my practice, I center trauma informed care and psychoeducation, aiming not only to support healing, but also to raise awareness and build resilience in individuals and families impacted by inherited trauma. So let's take a look at what all we're going to be chatting about today. Here's a roadmap for you guys so that you know how to pace yourself and what's coming. When we think about trauma, we often think of it as something that happens to an individual, but trauma rarely ends with just one person. Its effects ripple outward, shaping how families function, how communities carry themselves, and even how cultures evolve. We see this across the world, but it's especially visible in South Asia, where our histories are filled with large collective ruptures. Events like colonization, the partition of India and Pakistan, caste based violence, and waves of migration and displacement left deep wounds that were not only personal, but also generational. Many families carried those wounds silently, never speaking of what was lost, who was harmed, or how survival was achieved. And yet, even when unspoken, these experiences live on. They show up in parenting styles, in how emotions are handled, in identity struggles, and in the way families relate to one another. So, what does that mean clinically? I guess clinically, when I meet a client, I'm not just meeting their story. I'm also meeting the stories of their parents, their grandparents, and even earlier generations. So, my client who shows up and who is struggling with anxiety, depression, or interpersonal conflicts and difficulties may be carrying echoes of trauma that happened long before they were born. Recognizing this shifts our perspective immensely. So, in this webinar, we'll cover what exactly is intergenerational trauma, why does it matter, and why a trauma informed lens in our practices is foundation for healing. We'll also look at how trauma travels. We'll widen our lens to cultural and systemic forces. We'll also look at what clinicians need or can do to approach intergenerational trauma. We'll cover holding space for grief, working with ambivalence. We will also cover key takeaways, and we'll close with your questions. So this material can be really tender. If you need to take a step away, please do. I'll offer some grounding pauses between heavier sections. You're also welcome to jot down questions in the chat as we go, and we'll collect them for Q&A later. If you take one thing from the agenda, let it be this: honor what once protected the family and update what costs you now. Let's jump in. So I wanted to begin with this quote by Dr. Resmaa Menakem, an author and a psychotherapist specializing in effects of trauma on the human body. It beautifully captures the essence of intergenerational trauma. What we often mistake as someone's personality or a family's way of being may actually be trauma that has never been named or healed. For many of us from South Asia, this rings especially true. Histories of colonization, partition, migration, and displacement live on in families today, sometimes silently. These legacies shape not only how we see ourselves, but how we relate to others across generations. This sets the stage for today's conversation, recognizing these inherited wounds and exploring pathways to healing. What exactly is intergenerational trauma? Intergenerational trauma, also known as transgenerational trauma or inherited trauma, especially refers to the transmission of traumatic events or their biopsychosocial aspects from one generation to another. This transmission can happen in many different ways. One of the biggest ways that it shows up is through family dynamics. If a parent grew up in a household where fear or loss dominated, they may, without even realizing it, parent from that place of fear, perhaps by being overly controlling, emotionally distant, or constant hypervigilance. Children absorb these dynamics, even if they never experience the original trauma themselves. Another pathway is through silence, which I'm pretty sure some of our South Asian folks can absolutely relate with. For instance, never talking about painful histories like displacement during partition, caste-based discrimination, or migration struggles. These silences create a kind of unspoken tension, and children sense that something is wrong. They sense that something is going on, but because it is never named, they often internalize the anxiety or confusion as their own fault. We also see this through different family narratives. What is spoken about, what is exaggerated, and what is omitted. A family may pass on stories that highlight survival and resilience, but they may also pass on messages about shame, mistrust, or we just simply don't talk about this. These narratives deeply shape how individuals see themselves and others. Let me share a compelling example on how trauma affects on a biological level. In research that was done on Holocaust survivors and their children, scientists identified differences in DNA methylation, which is just a fancy way of saying that trauma altered their DNA, particularly how their bodies managed stress. This was then passed on to their descendants. These methylation patterns may alter how individuals may be more prone to heightened stress responses, even without the direct trauma exposure. More recently, researchers compared multiple generations exposed to war trauma and found distinct epigenetic signatures depending on whether the exposure was prenatal or direct. Now, when we look at it from a South Asian lens, scholars have identified that the trauma of partition, forced migration, caste-based violence, and systemic oppression may have left similar biological traces in our families. The empirical studies are still sparse, but the field of social epigenetics is still young. But what these studies and these research do offer is a powerful metaphor and a growing body of evidence, obviously, but a powerful metaphor nonetheless, that trauma can be biologically embedded and those embeddings can travel across generations. It shows us that trauma can literally change how genes express themselves. Changes in stress hormones or nervous system functioning can be passed down, making children and grandchildren more vulnerable to anxiety, depression, or hyperarousal, even if they never directly experience the original trauma. In South Asian contexts, we cannot ignore collective ruptures and collective trauma. Colonization, partition, caste-based violence, displacement, all of it left such deep wounds in individual families and across entire communities. These histories ripple through generations, shaping identity, belonging, and how people carry themselves in the world. So, when we think about intergenerational trauma in South Asia, it's not an abstract idea. It's rooted in very real histories and experiences. Centuries of British rule disrupted economies, created famines, imposed systems that devalued local knowledge and culture. Families who lost land, livelihoods, or cultural continuity often carried forward feelings of disempowerment, silence, and mistrust of authority. These patterns still echo today in some communities and how they internalize or struggle with collective self worth. Then there is the partition of 1947, one of the largest mass migrations and displacements in human history. Over 14 million people were uprooted, and countless families were separated by borders, violence, or forced migration. Many survivors never spoke about what they endured, whether it was losing family members, homes, or entire communities. Their children and grandchildren often grew up in households marked by unspoken grief, anxiety, or overprotectiveness. Even today, we see lingering fear, mistrust, and fractured identities that stem directly from partition. And we absolutely cannot ignore systemic discrimination, particularly the caste-based oppression and communal violence. Generations of people denied dignity, safety, and opportunity, often internalized shame, hypervigilance, and survival-based strategies. These adaptations, while once necessary, become burdens when passed forward into contexts where the threat is no longer immediate, but the body and the psyche still remembers. What ties all of these examples together is this. Trauma is not only personal, it is historical and collective. Colonization, partition, systemic oppression, all of it left wounds that ripple across generations. These stories explain why so many clients we see today carry struggles that began long before their own lifetime. So the key takeaway here is that intergenerational trauma is not just a psychological concept. It's something that impacts identity, relationships, and everyday functioning in very real ways. So by naming it, we can help our clients, our friends, our peers understand that the struggles they may face may not only be their own, but a part of a much larger story. And that opens slightly the door to healing. Now that we've explored what transgenerational trauma is, why it matters, and how it's transmitted across generations, both psychologically and biologically, let's take a moment to hear from Dr. Gaber Mate. In this video clip, he offers a powerful explanation of how trauma doesn't just live in the past, but continues to shape our present, often in ways we don't even realize.
So trauma is not just personal, it's also cultural and it's historical, and it's also transgenerational. And we just can't help passing it on. So if I carry trauma, I can be sure to pass it on to my kids unless I've resolved it, worked it out. And to the extent that I resolved it, I don't pass it on. And to the extent that I haven't resolved it, we do pass it on. And now, if you look at the larger question of why are so many kids being diagnosed, well, you know it can't be a genetic problem because genes don't change in a population over 5 years or 10 years. So if you're seeing much more ADHD in Norway now, there's a good reason for it. And the reason is that must be, and I don't know much about Norway, but the reason must be that the parenting environment is less and less comfortable for kids. The parents are more and more stressed. The parents are more and more busy. The parents are more and more distracted. Marriages are more conflictual. Maybe there's more depressed people around. Economic stress for both people to work. Communities maybe are less connected. There's less and less of that village, of that attachment village, of that hunter-gatherer type union between people. So because that's what globalization does, is it just keeps destroying and destroying and destroying the basis of human existence in the name of economic progress. And so more and more parents are stressed. Guess what? More kids are going to get diagnosed. And then we say, the kid's got a disease, let's give him a pill. Rather than looking at, well, what is it about the environment? Because the good news is, and I'll talk about that later again if I have a chance, is that the brain can develop new circuits, as I mentioned before. The question is, what conditions is required for that? And if we really understood the implications of the science and the wisdom, then the questions would be asking ourselves, okay, if all these kids are developing problems, what conditions are causing that? And what conditions do we have to create to lead them in a new direction, to help them reconnect?
So Dr. Matei explains how trauma is not just about what happens to us, but what happens inside us as a result, and how these internal effects can influence parenting, relationships, and emotional development over time. So why is it important? Why are we talking about it? Why does it matter so much? And why does it matter so much specifically in a therapy room? When my clients present with symptoms that don't quite make sense when viewed only through their individual history, I have to widen my lens. I have to make sure that I am identifying things that maybe they're not speaking about. So they may experience anxiety, depression, substance use, PTSD-like symptoms without ever having lived through a trauma themselves. Other patients, other clients might struggle with emotional regulation, low self-worth, or interpersonal relationship difficulties that seem way out of proportion for their personal experiences. A definitive clinical timeline for treating intergenerational trauma simply does not exist because healing is a highly individualized and non-linear process. But therapy can help recognize and address the effects of how it manifests. So someone who grew up with a parent who lacked warmth, was often distracted, and offered no praise, comes to therapy and comes to an understanding through therapy that the parents' responses were based on their experience of trauma. This may help them realize that those responses did not reflect their lack of value. We also see these struggles reflected in family patterns. So some families that I work with, especially South Asian families, they live in silence about the past. Painful events are never spoken of, creating a sense of mystery or heaviness. In others, I see cycles of shame, abuse, or neglect repeating across generations and generations. Some families express trauma through overprotectiveness or constant hypervigilance, as if danger is always near, even when the environment is safe. In South Asian families who lived through partition, a grandparent's unspoken terror of displacement might resurface generations later as their grandchild's chronic fear of being abandoned, even in secure relationships. Similarly, in families affected by caste-based oppression, strategies of invisibility and keeping quiet may once have been essential for survival, but now show up as difficulty advocating for oneself or setting boundaries. So as clinicians, one of the biggest and the most meaningful shifts that we can make is in our language we use and the lens through which we view those we serve. So rather than asking, what's the presenting problem, a question that can unintentionally center the difficulty, we can ask, what experiences or events have you and your family gone through that might help me understand your current challenges? This shift invites curiosity, compassion, and a broader clinical understanding. It acknowledges that people are not defined by their struggles or symptoms, but are often carrying the impact of experiences that are larger than themselves. And just as the effects of pain can be passed forward, so too can the capacity for healing, resilience, and connection. Research also helps explain why intergenerational transmission of trauma happens. One of the research studies quoted here was done by Yehuda and colleagues. They studied Holocaust survivors and their children and found changes in DNA methylation of stress-related genes. What this means is that the body stress response system can actually be altered by trauma and then passed down, leaving descendants more sensitive to stress and anxiety. Closer to home, Research in South Asia using the Denali inventory found that both the children and grandchildren of people who lived through partition still show signs of intergenerational trauma. This supports what many clinicians observe, that the unspoken pain and grief from partition didn't just fade away. It continues to shape families even now. And this impact isn't only emotional, it shows up in our bodies. A review looking at health among South Asian immigrant communities connected higher rates of conditions like heart disease and mental health challenges to historical trauma, including colonization and partition. The authors suggested that social, economic, psychological, and biological factors all play a role in how collective trauma can influence health across generations. Some neuroimaging research has shown that children born to mothers exposed to severe trauma sometimes have smaller amygdala volumes. Amygdala is a brain region central to processing fear and emotion. Can you imagine for a second how deeply embedded a traumatic experience has to be to alter the development of a very important region of our brains? Similarly, historical famine exposure in South Asia has been linked to higher risk of metabolic diseases across generations, suggesting that deprivation during colonization may still echo in health outcomes today. So when a client comes in with anxiety, depression, or interpersonal conflict, we have to widen our lens. Their symptoms may be carrying the weight of their family's history. And that's why we have to shift from asking, what is the presenting issue, to what are the experiences or events that you and your family have gone through? What can you help me understand that can identify these current challenges that you're going through? And this reframe validates their experience and opens pathways to healing. As I mentioned earlier, this topic is tender, it's heavy, so I'd like you to take a pause, just take one deep grounding breath with me on the count of 3. And exhale for 3. And if it feels okay, we'll do it one more time. Let's move on. So why is it important that as clinicians, I have to have a trauma-informed lens, or as community, we have to have a trauma-informed lens? When working with intergenerational trauma, a trauma-informed lens is not optional. It's essential. It shifts how we approach clients, how we interpret their symptoms, and how we design the therapeutic process. So we have to rely on the first few core principles: safety, trust, empowerment, and choice. My clients need to know that they're not going to be re-traumatized in therapy, that they are in control of the pace, and that their cultural values are respected. Trauma-informed care also requires contextual awareness. So in South Asia, many families live with unacknowledged legacies of historical events like partition and colonization. And partition survivors, children often describe their parents as emotionally unavailable or highly controlling, patterns that they now recognize were shaped by the chaos of forced displacement. Naming these systemic and historical legacies in therapy helps clients understand that their struggles are not purely personal, but tied to a much larger history. Research also shows how effective this lens can be in trauma-informed programs with refugee families. Integrating cultural rituals alongside psychotherapy improved outcomes in anxiety and relational functioning immensely. This suggests that honoring cultural narratives and practices isn't extra, it's central to healing. So let's take a concrete example to kind of understand this a little bit more. A young South Asian woman in therapy may describe feeling intense guilt around setting boundaries with her parents. And instead of identifying that as an individual issue, or instead of framing it as an individual issue, with a trauma-informed approach, I have to consider how her family may be carrying survival legacies from displacement, from migration, from caste-based marginalization, where safety once meant sticking together at all costs. Understanding that context allows me and her to help separate inherited survival strategies from her own needs in the present. So, clinically, this lens reduces shame and increases compassion for both the client and their family. It strengthens the therapeutic alliance in the relationship because then my client feels fully seen. And most importantly, it opens the possibility that if trauma can be carried forward through generations, so can resilience, culture, and healing. Let's take a closer look at how exactly trauma actually travels across generations. When we ask how trauma travels across generations, the first answer lies in behavior modeling. Parents and caregivers who live through trauma often unconsciously pass down their survival strategies. A parent who grew up in an unsafe environment may become overprotective, controlling, or emotionally distant. Their child then learns to relate to the world through fear and disconnection, even without experiencing the original trauma. The second mechanism is through silence and secrecy. Many families never speak of painful histories. Survivors of partition often carried horrific memories of loss, but choose silence as a way to protect their children. Yet, silence itself communicates something, that certain topics are dangerous, that grief must be hidden. Children grow up sensing the weight of the unspoken, internalizing anxiety or shame without ever knowing its source. Trauma is also transmitted through narratives and storytelling. The stories families choose to tell or not tell shape identity and belonging. A narrative that emphasizes resilience can strengthen a sense of pride and survival, while one that centers on shame or mistrust can create intergenerational patterns of fear. And finally, we now know trauma can move across generations through biological pathways, and research in epigenetics shows that trauma exposure can alter gene expression, especially in stress related symptoms. So, when we think about trauma transmission, it's not one single mechanism. It's behavioral, relational, narrative, and biological. And most often, all of these interact together. I'll give you another example of one of my clients. A young 28-year-old woman grew up in India and grew up in a household where emotions were rarely expressed, and any talk of Pakistan was met with tense silence. Her grandmother had survived the partition of 1947, fleeing from Lahore as a teenager after witnessing the murder of her father during the riots. Though grandma never spoke of it openly, the trauma shaped her parenting. She was overprotective, fearful of outsiders, and very emotionally distant. So my patient's mother inherited that anxiety, raising my patient in a home filled with unspoken fears, strict boundaries, and a deep sense of insecurity. Now, as an adult, my patient struggles with chronic anxiety, trust issues, and is unaware that the roots of her emotional world lie in a trauma experienced generations before her birth. So, what does that help us understand? It helps us understand that intergenerational trauma doesn't unfold in a vacuum. It is shaped by the systems people live inside. Centuries of colonization and the rupture of partition of 1947 fractured families and identities across South Asia. The echoes of that upheaval still shape health and mental well-being today in descendants and across the diaspora. Caste and communal violence continue to wound. Systemic discrimination and exclusion create chronic stress, limit access to care, and deepen risks for depression, anxiety, and self-harm. When stigma and inequality persists, trauma quietly passes forward. Migration adds another layer. For many refugee and migrant families, trauma doesn't end at the border. It compounds, from violence and displacement to racism and economic struggle in the new lands. Studies show that children of war-affected parents often carry emotional burdens, even when they were never directly exposed to the original events. Collective trauma changes how communities trust and connect. So when social bonds break, families often rewrite their stories to survive. And those stories, shaped by loss, silence, or resilience, become the bridge between generations. Barriers to healing remain very real. Stigma, cost, language keep many from reaching for help. In many communities, identity-based discrimination still discourages people from seeking care at all. But here's the hope. The same systems that wound can also heal. When care honors cultural rituals, shared language, faith, and community remembrance, recovery strengthens. These are not extras. These are active ingredients of healing. What do we do with that? How do we know that the past is in the room with us? So we're shifting a little bit. We're shifting the gears from what intergenerational trauma is to how do we spot it? These are practical clues, patterns in symptoms, language, relationships, and the body that tell us a family history might be driving today's distress. What we are actually looking for during assessments or our initial meeting with our clients, we're looking for clusters rather than a single symptom. Patterns that don't map cleanly onto a personal event, but make sense when we widen to family history. So when pain is inherited, it shows up in the ordinary, how the body stays alert, how feelings get managed, how closeness is negotiated, and how identity is scripted across generations. You'll see systems like tuned in for danger, scanning, exaggerated startle, poor sleep. This isn't character, it's conditioning. So what do I do when I spot this? I get curious. I ask, when evenings get quiet, what does your body do? How does your body respond? Sometimes I met with what? What does that question even mean? But we move on. Many clients learned early that big emotions threaten stability. So two common emotion strategies that I see are turning feelings all the way down. So flatness, no emotion, poker face, or difficulty naming emotions. Everything is bad. I don't know what I'm feeling. What do you mean where I feel it in my body? I feel it in my brain. Again, what do I do when I spot that? I get very curious. And I ask weird questions like, when strong feelings show up, what's the fastest way they get put away? Relational blueprints travel and create attachment echoes. Caregivers with unresolved trauma or loss can display frightened or dissociative behaviors. Infants adapt with disorganized strategies that later look like come close, go away patterns. In adults, it's the text and retreat dance, neediness shamed into self-sufficiency, or intimacy framed as risky. Again, get curious. How do you know it's time to pull back or to chase? In intergenerational contexts, identity is negotiated against family survival rules. Don't think about yourself. Be loyal. Don't make waves. Carry the dream. Again, a question that makes my clients very uncomfortable is, what did being a good child mean in your family? Oof, heavy question. Trauma legacies are embodied. Meta-analytic work links adverse childhood experiences with functional gastrointestinal problems, like IBS. Developmental reviews highlight early adversity as a risk factor for adult IBS, especially alongside anxiety. So in my sessions, sometimes that looks like jaw and shoulder tension, breath holding, sometimes stomach flares before family calls, or I can't stop taking care of everyone. I am responsible. I have to be responsible. So we can spot these patterns, but what do we do? What do we do after we spot them? The next step is to identify how to create conditions that can foster healing. So what helps? Updating old safety rules without shaming the system. Our aim is to help clients keep the wisdom of what protected their families while retiring what now costs them. So we'll work in phases. We'll stabilize the body and life first, then process what needs to process. And finally, integrate into daily relationships, identity, and culture. One of the best ways to work through that is narrative therapy. Narrative approaches are especially helpful in working with intergenerational trauma because they allow clients to hold a larger story, one that includes both pain and resilience. So I start by externalizing inherited beliefs or legacy rules, such as our family learned perfection to survive, and help clients contrast the past with the present. So, what are some of the experiences or events that you and your family have gone through that can help me understand you now? What can we discard? What do we need to keep? What do you want to keep? Creating layered timeline of personal and family events, places, and rituals can also surface patterns and symptom spikes, while also building insight for our patients and our clients. Our intention is to help them create newer stories and a newer narrative of what they experienced and discard the old one. When working with intergenerational trauma, it's also important to remember that these patterns often live in the body. So we start there. We start by teaching slow resonance breathing. Let's try to engage the parasympathetic nervous system. How do we signal safety in the present? How do we orient ourselves in the present by slowly scanning the room, naming colors or shapes that can help reduce threat bias and bring the individual back into the present? We can also incorporate some trauma-sensitive movement like yoga, mindful walking, self-holds, but always emphasizing choice and consent. Practices like pendulation, moving between tension and neutrality, engaging your body in slow movements, rocking back and forth, vagal toning, using hums, long exhales, support nervous system regulation and help clients build capacity to safely explore deeper emotional material, especially when inherited trauma has been stored in body for generations. My favorite, EMDR, eye movement desensitization and reprocessing. This is an incredible modality when it comes to intergenerational trauma or any trauma for that matter. It's a trauma therapy that helps the brain and body reprocess distressing memories so they no longer feel like the present day threats. They're okay. They're able to discard what happened in the history, and they're able to process the distress in real time. So when we use EMDR to address intergenerational trauma, the focus isn't on reprocessing a grandparent's memory, but on healing how that legacy lives in the client today, in their triggers, in their body responses, and inherited beliefs like, if I'm not perfect, we're not safe. EMDR works by bridging present reactions with inherited meanings. And ultimately, EMDR helps release the stuck wiring between today's triggers and yesterday's inherited fear, freeing the client to live from the present rather than from a family's unfinished story. It is important when we're talking about culture and intergenerational trauma to include some culturally responsive practices and rituals. So culture isn't an add-on. It is the framework through which clients experience safety, meaning, and healing. So culturally adapted care involves more than just translating a language. It means adjusting pacing, honoring family and community norms, and using familiar idioms of distress. With South Asian clients, for example, culturally adapted cognitive and behavioral therapy has shown the need to modify engagement, assessment, and session tasks. CBT has been historically known to serve white populations the most, but we can culturally adapt it. We can modify it. When appropriate and with consent, collaboration with families, elders, or faith leaders, making it collaborative so that it can support healing, especially through practices like oral storytelling, meaningful rituals, small symbolic acts like setting a small boundary or lighting a candle, cooking a family recipe, honoring your culture. These can create powerful shifts. Always maintain safeguard around consent, confidentiality, and clear communication. But it is very important that to invite safety, we also invite the culture in the room. Why does it matter what we do? Why is it important that as clinicians, as providers, that we not only recognize intergenerational trauma, but work with it, hold space for it? As therapists, our role in working with intergenerational trauma is not to diagnose the past, but to create a safe, compassionate space where inherited pain can be acknowledged, explored, and honored. We hold space for patterns that may have originated long before the client was born, patterns of silence, fear, hypervigilance, or disconnection. By approaching these experiences with curiosity rather than judgment, we help our clients make sense of what they've been carrying and why. This involves being attuned not only to the client's words, but also to their emotional responses, their body language, and family narratives, spoken or unspoken. The therapist acts as a witness and a guide, helping the client gently uncover how trauma may have been passed down, while also supporting the development of new, healthier ways of being. In this way, therapy becomes a space not just for healing the individual, but also disrupting cycles of inherited pain. Intergenerational trauma work at its core is grief work. And grief work is around losses that were ambiguous. There was no closure, no goodbye, or disenfranchised. They were not recognized or validated by others. So we honor what protected your family then and grieve what was lost at a pace your body chooses. Another major aspect of working with intergenerational trauma in a therapeutic space is working with resistance, working with parts that get defensive. My childhood was fine. My family never treated me bad. It was fine. Everything was fine. I had a good childhood. Listen, if you have to say that you had a good childhood and you're sitting in a therapy room, I have some questions. But it's also interesting to notice that resistance. It is this whole work, this intergenerational trauma work is working with resistance. And what looks like resistance is often a protector part, that learned change equals danger. We don't speak about this. It's so deeply embedded that it's unsafe to speak about it. So we approach it with curiosity and gratitude and support. We support our clients in running tiny, safe experiments, a small boundary, a moment of prepared enough instead of perfection, always followed by nervous system regulation. So, all of this amounts to this. Intergenerational trauma does not just live in our memories. It lives in our everyday life, in the ways we love, protect, withdraw, and strive. It travels through silence as much as through story, through body as much as through words. But just as pain can be passed forward, so can healing. Every time someone names what was once unspeakable, offers comfort instead of control, or practices safety in the present, the patterns begin to shift. As practitioners and community members, our task is to see symptoms, not a sign of weakness, but as echoes of survival, to bring curiosity where shame once lived and compassion where fear took root. Healing intergenerational trauma isn't about erasing the past. It's about transforming its inheritance. When we stabilize the body, reconnect to meaning, and honor culture as a source of safety and strength, we make it possible for our new stories to begin. The work moves slowly through small, repeatable moments of safety, but those moments ripple across generations. This is the quiet power of this work, healing that reaches both backward and forward in time. So thank you. Thank you so much for leading into a conversation that is both tender and necessary. Before we open for questions, I'll invite one tiny reflection. What is a family rule that kept you safe then, but needs a new version now? Take it as a homework. I'll also invite one collective breath to close this section. We'll inhale for 4 seconds and long exhale for 6. Drop your shoulders, unclench your jaw. Deep inhale. And long exhale. I'm grateful you're here. And with that, I'd love to hear if you have any questions.
Thank you so much, Shravni. And yes, if anyone has any questions, feel free to come off mute or put it in the chat box, whatever you are comfortable with. And if you don't have any questions in this moment and you think of something later, of course, Shravni will share her information with all of you so you can get in touch with her if any thoughts come up or anything. But we'll give it a minute if anyone has anything.
Yeah. And I have the QR code for my LinkedIn on the screen. If you want to connect with me, if you have any questions, professional, clinical, cultural, I would be happy to answer that.
We just have some gratitude in our chat box. Thank you.
Thank
I
you.
have some question. I know it's dark right now, sorry. Can you see me?
I can see you, yeah.
Okay, yeah. Sorry, it's dark. I have a question. How much is your session?
So I'm currently working with an agency, and so the
Uh-huh.
agency decides the rule, but it's also dependent on insurance. I'm not private pay right now.
Okay, what type of insurances do you
Yeah.
accept?
We have Medicare, Medicaid, all commercial. And if you want to connect with me on my LinkedIn, I would be happy to answer all of those questions as well.
Okay, sure. I will connect with you.
Yeah, I'd be
Okay.
happy. Any other
I have a
questions?
yes, I have a question. Can you hear me?
Yeah, absolutely.
So, a problem I've noticed really frequently within others in the community is just an inability to access any form of therapy or healing that's culturally informed or conscious.
Mhm.
And that might be just a local problem, or also in general, like I know for me personally, in-person therapy is much more effective than online. And because it's inaccessible due to just like geographical problems or anything like that, how would you recommend they go about conversations with either white therapists or therapists outside their culture when it comes to addressing those problems?
That's such a great question, and I really appreciate you bringing it into the conversation. I think it depends a lot on the therapeutic alliance with the therapist. I understand that there may be some initial resistance and initial hesitation in working with a white therapist because there's a lot of psychoeducation that goes both ways. You, as a patient, have to educate your clinician basically about your culture. But I think as a therapist, I can assure you that clinicians do make space for that. I invite so much of cultural knowledge from my patients who are different culturally than I am. So I think that the best way to approach it is to engage with your therapist to identify if there is any hesitance in them learning about your culture or if they're open to learning about your culture. If that doesn't seem too accessible, I also invite to look at community resources. If there are any agencies in your local communities that offer sliding scale options or that offer community groups, support groups that are culturally focused. But working with a white therapist can be difficult initially, but if you are able to build that trust, if you are able to build that safety with your therapist, then I don't think that there would be a problem educating them about your culture. Not to say that it should be a responsibility. I'm hoping that your therapist does some homework, and is also curious about your culture and understanding how your culture impacts you. But if that's not the case, then I invite you look at community resources, and if there's anything that's locally present, or if there are, you know, um, platforms like South Asian Care. I know that South Asian Care has done a great job in listing providers that do create culturally responsible care and therapy, and the providers work from that cultural competence. So I definitely invite you to look into some community resources. I hope that helps answer your question.
Yeah, for sure. Thank you.
Yeah, of course. Thank you for asking. Any other questions that I can answer? Well, thank you so much for tuning into this conversation, and I really appreciate you guys being present here.
And a quick thank you, especially to you, Shravani, for putting this amazing presentation together. I know it was extremely informative and impactful. And thank you, everyone, for joining this important talk. We have a lot more events coming up, so please stay tuned on our South Asian Care website. And we also look forward to more collaborations with you, Shravani.
Thank you so much.
Thank you. Have a great evening, everyone. Bye.